Hello and welcome to this information about dyslexia. My name's Steve and I'm one of the assessors that conducts the assessments for dyslexia. So really, what is it that we're going to be doing? Well, before we get started, there's some forms that we want you to complete online. So the first step is to complete our consent, care and treatment form and accessible information. There's a link on the website below. Click on that, fill that form, and you only need to do that once. The second thing that we want you to fill in is our developmental history form. So this looks at the challenges that you've faced throughout your life with dyslexia or potentially dyslexia, looking at those strengths and those areas of opportunities and development. We then look at step 3, where we try to gather more information about you from other professionals. So we ask for your teachers or SENCO leads. And then finally, we're going to look at booking the assessment with you. So the assessment could take between 3 to 5 hours, depending on what it is we're going to be doing on the day. However, we work in line with the SASC standards, and they are very strict in the way that we conduct the assessment and the way that the reports are written. So, for example, we're going to be doing an assessment around your cognitive profile and reasoning. Throughout that, we're going to use lots of different assessment tools that will help us to determine whether or not there's a deficiency or an area of weakness within that area, or we'll look at what we need to be able to do to kind of bring that up to an area of strength. We'll be assessing your areas around profile and memory, your phonological sounds and rapid naming, speed naming. We'll be looking at those motor conditions, so the kind of handwriting. We'll be looking at your attainment around reading, spelling, writing, and mathematics. Don't worry, it's not a test. They're little assessments that help us build up that bigger picture about you. What we want to make sure is that we're not missing anything off the back of your assessment. What happens once all the evidence is gathered? We'll go to our MDT, we review you as a patient, and we'll seek advice and guidance before we all draw together a conclusion whether or not we meet the criteria for a diagnosis. If you don't meet the criteria for a diagnosis, don't worry, we'll explain what it is and why. And if you do, we'll write you a list of recommendations and the things that you can accept or expect under reasonable adjustments for you. If you need any further information about our dyslexia process, please don't hesitate to contact us, call the numbers on screen, or again, just fill in the form. Anyway, it's been a pleasure to talk to you today, and we look forward to welcoming you to our assessments. Bye for now.